Thank you for the organizers for inviting us to be part of this afternoon. We have a little bit different project to talk about, but we share in our work together over the decades, I guess now, many of the same things that we've been talking about, and hopefully you'll find our experience of interest as well. So I'm from the Center for Injury Research and Policy, and Kevin's from the Baltimore City Fire Department, and we wanted to start by telling you a little bit about the Injury Center, which is a short 4-minute video, and one of the reasons I'm using it is because it features somebody very special in the middle of it. So make sure you pay attention to that part.
One of the biggest problems I looked at early in my career was that of little kids in cars. I was working in the medical examiner's office. We'd see the bodies that came in from crashes, and perhaps the most tragic were the little kids and the babies traveling in their mother's arms, unrestrained. Nobody was doing research in this area. We saw a need for a center where we would have colleagues doing good research together that would help to prevent injury. The Centers for Disease Control and Prevention agreed with us, and they funded us to start the center. That was 1987, and we haven't stopped since.
So we've done a lot of research in the past that described what happens after you've suffered a very severe injury. And what we found was the trauma surgeons do a great job of putting people back together. And yet, in the end, trauma patients and their families needed support for not just the physical consequences, but also the psychological consequences from a traumatic event. Post-traumatic stress, anxiety, depression are all very common consequences from severe injury. So we worked closely with the American Trauma Society and some of the leading trauma centers around the country to build the Trauma Survivors Network, a program that helps injury survivors connect and learn from each other. And just having somebody who knows what they've been through makes a huge difference. We need to get the Trauma Survivors Network running in every trauma center around the country.
My mommy is right. Okay, go clear. Remember the police. Okay.
It's a simple questionnaire. 11 questions that police ask victims when they respond to a call for domestic violence. If the victims answer affirmatively to certain questions, the red flag goes off. They're in high danger. It's a relatively simple assessment. The officer can immediately connect the victim to services that could help save their life. We're collecting this data to both evaluate and improve the program so that other jurisdictions that are interested in implementing the program can use it effectively. We're connecting research to real life.
We care about keeping kids safe. No one ever wants to interact with a family in the emergency room after their child's been injured. But it's our job to help those injury prevention messages resonate in a way with families before the event.
Learn about safety.
The Mobile Safety Center is basically a 40-foot truck where we've designed the inside of it to look like a common home. For instance, we take a normal-looking stove and point out the hidden injury hazards to a parent and to young children. Not to freak them out, not to scare them, but to educate them so that they can properly protect their children.
Can you touch that? You never touched any kind of fire.
Well, it's a great tool to teach families how to keep their homes safe for their children.
It's a model that we started here and it's being replicated all over the world.
I wanted to kick off our conversation with the beginning part of our center story, because I hope it illustrates how our commitment has always been to what we say, closing the gap between research and practice to prevent injuries, because of the toll that they take. The leading cause of death for children continues to be injuries. Baltimore City still has a problem with house fires, et cetera. And so those were just 3 quick examples of how our researchers engage with, whether it's the trauma care community, or it's the police and law enforcement community, or it's the wonderful fire department community, to bring prevention to the streets of Baltimore. And our partnership really started back in 1997, and I characterize the 1997 to 2000 era as sort of getting to know you. I don't know all the lyrics of that song, but that was the getting to know you, and we realized that we had a lot in common, and what we really want to do is get homes safer, get smoke alarms in homes in Baltimore City. And then from 2000 to 2004 was when we really got to know all about you, and vice versa. And we actually did a lot of fundraising, a lot of planning meetings, a lot of work to get the Mobile Safety Center up and on the road. And part of that effort was really grounded in the desire to find out from research what makes a difference? How can we actually get homes in Baltimore safer? And so through that process, we've together done 2 big research projects that involve the Mobile Safety Center. But you can see it's really also a service program that has its own life and continues to bring services to Baltimore City. One of our biggest research projects just finished, and it involved several partners with the fire department, including the Environmental Justice Partnership and Banner Neighborhoods Community Corporation. And so I brought copies of this because one of the things that I haven't heard too much about today is how do you take your research and get the results back to the community that helped you do the research? Even if they're not part of your planning team, those people who gave you data and information and let us in their homes are a part of the community that we're responsible to. So this was our dissemination guide for the most recent research project that we finished. But as I said, we're more than just a research partnership. We're a part service and research, and I'm going to turn it over to Kevin to answer the really hard questions that we were asked to address.
Some of the things that I wanted to bring into the forefront is when the MSC started, I was just coming aboard with the fire department. It's about to reach its 10th year, and we're going to have a 10th year anniversary celebration in 2014. So for 10 years, we've been out in the community trying to change the behavior of the community and the practices that we've seen in the community. And when I say community, I do mean the community here and around Hopkins, West Baltimore, within the city limits. Because Baltimore City's fire department, of course, we don't have a specific area that we want to focus. Our area, our jurisdiction, our focus is Baltimore city limits. So we go all over, and the public education division of the fire marshal's office, we go throughout the city talking about, preaching about, changing the behavior of poor practices which have put our children and our families in danger. And if you think about some of the things that we were taught way back from our parents and grandparents of some of the things that will just work, it's amazing that we survived into the 21st century. Car seats, seat belts, and many other topics. On the Mobile Safety Center, we do have a lot of topics, 10 to 12 injury topics that we talk about on the Mobile Safety Center. The other project that we had was the home safety study, which addressed one of the leading causes of injuries to children and families, and that was fire and fire safety. The challenges were, how do we get it done? How do we get what we're trying to get across to the community done? Through a wonderful partnership with Johns Hopkins School of Public Health, we were able to get it done. Now, of course, there were some challenges there because our perception of the Hopkins community was all they want to do is study it and get a paper and get a grant or something. They just want to study it. We want to get it done. So in putting those two things together, we were able to get it done and get the research and get the data, which leads to everything that we're now able to conclude and have some tangible results. Tangible results that I need to prove to local government, city government, that what we're doing is working. Without that data, without Hopkins putting in the effort and coming on board with us, or asking us to come on board with them. I don't know how the process worked. That was before my time. By doing that, we were able to get in the community and use the trust that the community has with the fire department. As a partner, we all got into the community, into the homes. And with the money, research, know-how, education, grant writing, and all of the things that Hopkins brought to the table, we were able to get a full project from beginning to I don't want to say end, because we're going to continue this ride as long as I'm part of it. But it's an ongoing, wonderful process. I had some notes and I had an order, but let's forget about the order. Did you have anything else that you want to add to what I've just said?
I think the funding issue is really important, and that's something that we worked on together a lot in terms of the fire department fundraising for what they need to operate their vehicles, and they do all of the maintenance on the van, the insurance of the van, driving it. We don't do any of that. We are the education arm, the education side of it, but we each put a person on the van. So we have an educator, and the fire department has Inspector Williams and a couple others, I guess. But so we always have to be mindful of how we're paying for those things to keep it going. And so we've been successful so far.
A brief history. When it rolled out in 2004, it came about because the fire department had an old, falling apart fire safety trailer, and we needed a replacement for it. And what better way than to have someone who needed to have a way to get out into the community come together and help to acquire the funding for this program. The Mobile Safety Center was the birth child of those two efforts. One of the last things, of course, I want to talk about some of the challenges that we had. Of course, it's just the cultural differences in fire department and the Hopkins community. And we found out that there really weren't many differences. We all had a common goal, and that was to change the behavior, the poor behavior of the citizens and families in the community, and to work together to get into the community and to bring a quality of education into the community. But the one thing I do want to say to everyone, fire fatalities is not the failure of poor firefighting. It is the failure of fire prevention. So that lies on me. When someone dies in a fire, that lies on me in prevention. Firefighters, they do everything they can to save that building. But if they go into a burning building, there's no lives to be saved. I have to do it before it happens. And that's why it's so important and so personal to me and my group in fire education. And I want to thank you. That's all I have.
I think the issue of prevention is the last point we really should emphasize. Is we have the shared value or shared goal of getting smoke alarms into homes, but really we have a bigger shared mission of prevention. And if you think about the government funding, prevention is often the first thing that goes. So I think being together in the rallying cry for we must fund prevention is another way that we can be effective partners with each other.
Thank you very much. Next up is Lindsay Thompson from the Cary Business School. She is also the university co-chair of our Community University Coordinating Council, so she brings a unique perspective. She is also going to be speaking about a project where she is a member of the community as well as the university representative.
I'm from a business school, so I'm going to talk a little bit about the link between health and wealth and how that focuses on livable cities. How do I move this forward? There, okay. So I want to just start with the idea of livable cities that, we don't think very often about what cities are, but everything, almost everything that we value happens in cities. And, I can give you some statistics. In this country, about 80% of the people and close to 80% of the GDP happens in 100 cities. And that's on about 12% of the land mass. So this myth of red state, blue state, and a lot of states out there, and a lot of land and a lot of wealth, it's actually mostly happening on 12% of the land in 100 cities. So that's a little, and globally there's a similar picture. But also cities have real problems. So this is kind of how we're defining. It's a rolling definition as we clarify, but that's kind of how we're defining. The livable city is vital for health and wealth. But there's a problem with this, is we've created the way profit maximizing capitalism works, is we've created an economy that's kind of a false structure of disequilibrium and inequality and false scarcity. And it reminds me of this. Now, this is kind of an obsolete picture, but what we've basically got is we've got about 600 cities in the world that produce about 60% of the wealth, but we've got about 2,000 cities chasing after the corporate capital of the Fortune 500 companies or Fortune 1000 companies. There isn't enough money from those big companies. So we're kind of, cities can't move. We try to pretty ourselves up to attract investment capital from these big companies, but there just aren't enough of them for every city to have big corporate investors. So cities like Baltimore are especially vulnerable because we just aren't that attractive to those big Fortune 500 companies. And we've seen kind of the result of global recession and post-industrialism. We've tried to get some of this, and we have some, but really, mega development is not sustainable and it's not enough. So that has sort of made us think about, well, so what do we do as cities and in neighborhoods where most of the redevelopment, most of the economic vitality has to come from within? How do you do that? We're a business school, and we're supposed to be thinking about that. And I will tell you that most business schools don't teach or think or do research about how to do that very thing. They're more mega wealth creation and not small scale wealth creation. So we at the Cary Business School, we are supposed to be the business school with humanity in mind. Well, so we need to kind of think differently about how we research and how we practice and how we teach business. So we started with these kinds of questions. Is the neighborhoods that we're dealing with, how do they keep people from being wealthy? Not rich, mega rich, but how do they keep people from just getting enough so that they can thrive themselves and their children can thrive? And how can neighborhoods, ordinary neighborhoods, without $100 million or without $1 billion from external capital, how can they create and reimagine themselves? And how do we prepare the next generation of business leaders to work in this space? Because most business schools aren't preparing business leaders to work in this kind of space. So we created something called CityLab, which is just located in a neighborhood to learn how to do this. And we start with the neighborhood and the people rather than our own research agenda. So it's a little bit different. And we're looking at these 3 partner groups that we obviously have neighborhood stakeholders who are in the process of building their lives, however they do it, leading their normal lives. But we start with them and we connect our research and our students with them rather than start with our research and our students and then try to get them to help us. We're doing it the other way. We are envisioning this as we partner to them and for them, not using them for our research or however good it might be. So it's a little bit different. And we have 3 streams going on at the same time: socially engaged research projects, building best practice models for creating wealth and opportunity at a small scale in neighborhoods that are not cool destinations. So how do you re-envision that? And integrated active learning, that you're not learning in a classroom about, but you're practicing in a neighborhood and learning from people in the neighborhood how to do. And a lot of it involves unlearning. The CityLab neighborhood that we have in Baltimore is in Jonestown, and that actually goes back to 2004, where Albemarle Square was built as a Hope 6 community. If those of you who are familiar with Baltimore know that this used to be Flag House Courts. The reason we chose this neighborhood is it's really both troubled and it has opportunity. It was totally dismantled. Flag House Courts was torn down, and for about 6 years it was vacant. And in the 2010 census there were 1,500 people there. 500 of them were in institutional facilities like drug treatment centers and rehab centers and homeless shelters, and just under 1,000 of them actually live in houses, but almost all of them moved there after 2004. So it's a really new community, even though it's a very old historic community. So we're kind of dealing with a lot of rebuilding a community infrastructure. In the Hope 6 law, there was supposed to be support for that, but of course it wasn't funded, so everybody is kind of on their own. But at the same time, some of the oldest institutions and the oldest sort of small community anchors historically are in that neighborhood. For instance, the oldest continuously operating synagogue in the United States is in Jonestown. And it had been down to 10 male members, and now it's back up to about 200. The Flag House, We're the Flag, over Fort McHenry, that is, was written by it was the inspiration for the anthem. That was constructed and sewn in Jonestown. So it's a really historic neighborhood, but it has suffered so many disruptions in terms of the people for a long time. So it's a very complex neighborhood and a great place to start a business kind of CityLab. So we did a pilot in 2012, which was very successful by all accounts, from the neighborhood and from the business partners and from the students and the faculty. We also did a CityLab in Barclay, in the Barclay neighborhood. And we've started a CityLab in DC, in Ward 5, if you know anything about Ward 5. And what we found, that the key ingredients that we're working with that are really critical is field work, begin with the place and the people. The students begin with an urban immersion, that there's no class in the beginning. They do field work and do field notes and meet people in the neighborhood on their own, in the neighborhood, instead of having the neighborhood come to school, people in the neighborhood come to school. And we don't meet at school. We meet in the neighborhood. We do have some things at school, but we do everything in the neighborhood. And we are working on what we call strategic inclusive gentrification. We do need to have homeowners and people with assets and money to build the tax base, to do the kinds of things that people with assets have. But we need to connect them, first to people who don't have assets, but also to neighborhoods outside the neighborhood, to the Harbor East and more developed neighborhoods, so that we build a microeconomy that creates Jonestown as a value creator from people beyond the city. That's sort of the business model. We are committed to being part of the neighborhood for 10 years, and well, I'll be there till they take me to the home. So, I mean, we our understanding that we don't have a project that's going to be in the neighborhood for, a few months or even a year or two, that we are there. We also are close to school. We're 5 blocks from school, so it's really easy to go back and forth. And in the original Jonestown neighborhood, that included Harbor East. So in a way, there's a historical connection between Harbor East, where the business school is, and the Jonestown community. And we are building a microeconomy within the neighborhood that is connected to the larger economy. The students, when they first did their field work, this is what they saw. And I was even surprised at this. I've lived there since 2005, and I thought it was nicer than that. So I was kind of surprised. But this is what they saw. And so when we had the dialogue with, 5 more minutes, when we had the dialogue with community residents, almost nobody who lives in the neighborhood saw that until the students pointed it out to us. So one of the great things about having this partnership is when you bring eyes from the outside to your neighborhood, you see it in a different way. I got so used to seeing the abandoned lots and the broken down buildings that I didn't even see them anymore. But when these 25 and 35-year-olds people came in, and one of the questions that they were supposed to ask was, if I wanted to move into this neighborhood, what would be a good block? And when they were asking that question, they got lots of different responses, but they pretty much all said at first, I wouldn't want to live here. It just doesn't look and feel nice. But then when they go back for their second look and then start having more conversations, they see more in the neighborhood. And they're thinking like business investors, and they're thinking about, I'm a future, or some of them current, business creator, business innovator. I want to do a socially value creating business, and I want to locate in the city. So would this be a good neighborhood for me to build my business? And they start to see, when they think that way, they start to see different resources and assets in the neighborhood that they didn't see before, which is part of the whole purpose of this. And as far as the shared goals that we have, initially, everybody kind of agreed. There was no disagreement about this. We all want to revitalize the neighborhood. There's nobody who doesn't want to do that, except we have quite a few rats, and I don't think they care. We have a shared focus on placemaking, that we are identifying the eyesore properties first. They make a huge difference in how the neighborhood feels. And everybody, once we kind of saw through the students' eyes how bad it looked, we saw that and we all agreed that that's a priority. And the students are they're graduate students, they're all very, very welcomed. And some of the kids in the neighborhood now know them by name and call out to them when they see them on the street. We have these 5 strategies that we start with: placemaking, human flourishing, community building, citizenship, and it isn't until the end that you get to shared wealth creation and value creation. And ordinarily, business students start with the value creation. And then the other thing has come kind of as an afterthought. And this was really highlighted to me in a recent community meeting where we were talking about redevelopment in the neighborhood, and there's a new project up. And one of the developers, who's very active in the neighborhood, said, the problem is we build these great spaces, and we plan them, and they're very thoughtful, and then people moved into them, and they want to have a say. And it was like, that's a problem. And the citizens and residents of the neighborhood were saying, oh no, wait a minute, it's just the opposite. We want you to build a neighborhood for us that we can live in. Sure, we want you to make money, but it's for us. And this is a constant tension in redevelopment. And when you do it on a neighborhood scale, you see it much more personally. You don't hear about it in the paper. You know, there isn't a big article about it in the paper, but you see it in real relationships in the same room where people are talking. That you have to start with the place and the people. You have to build community and relationships. You have to build a sense of citizenship. And then you can start talking about creating wealth. And it's very similar to, we're using some of the transitional economy models that were used in after the fall of communism in East Europe. They had to build institutions and relationships for markets. And that's some of what we have to do at a neighborhood level, is build readiness for market participation, because not everybody knows how to participate in an economic market and how to create value in the market. I'm just going to run through these really quickly because I have about 1 minute, but we have specific visions of what each of these strategies means and what it should look like. And we're in the process of doing conversations with the community about putting specific goals on these. But we do have a number of projects that we're already working on. My favorite is to turn the top of the post office, which is 5 acres, into a garden, a commercial garden. Well, actually a farm. And that is a great business idea. It's really cool. The other business idea is to create Jonestown as a daycare and preschool provider community, because there's a huge commuter traffic that of families and people who work downtown at the hospital, at the medical school, at various places around Harbor East and now Harbor Point. And why do they want to leave their child out in wherever it is, 20 miles away, when they can leave their child 5 minutes away from where they work in our neighborhood in a great facility? So we're kind of looking at the idea of building that as a destination business for our community, because we have people who can do the work and need jobs, and we have space. We have 58 vacant lots and 8 vacant huge buildings, so we have plenty of space. So we're kind of looking at, that's going to be one of the anchor businesses in our neighborhood. These are some of our disruptive challenges that we're still working on. We're not done yet. We're pretty new. But nobody that I know of in the field work, the students really do ask this. Nobody doesn't like it, but I don't know what that means. We haven't been doing it very long. But we are getting lots of feedback that investment in place and relationship really pays off. We have a high level of trust that wasn't there 5 years ago. And beyond that, it's really too early to draw useful conclusions. But I would like you to come visit our neighborhood.
Thank you, Lindsay. Our final presentation is going to be from Joan Cubb and Nicole Johnson. And they were the recipients of one of the UHI small grants for community university collaboration. I think they'll be talking about that project.
Good afternoon, everybody. My name is Nicole Johnson. I'm the Senior Director of Elevate Baltimore, and I'm joined by Joan Cubb, who is an Associate Professor at the Johns Hopkins University School of Nursing. We're going to spend a little time this afternoon talking with you about the partnership between Elevate and the School of Nursing. I am really short, so
Is there some way of...
as long as I'm fine. I'm good, yeah. So we're going to spend some time just talking a little bit about the partnership, telling you a little bit about our respective organizations and agencies, laying out some of the key ingredients to the partnership and our experience with partnership, particularly working in schools in East Baltimore, and then kind of summarize with some of the challenges and lessons learned as a result of working together. So just to tell you a little bit about Elevate. So Elevate Baltimore, we partner with schools here in East Baltimore, coordinating services for children and their families. And our ultimate goal is to ensure that every child is ready to succeed in school and in life. Our work focuses in 3 areas. So we coordinate learning, health, and family engagement supports for children, initially targeting young people in middle grade, so 5th, 6th, 7th, and 8th grade, but now we work across the entire school. All of our schools are pre-K to 8, so we're working with families across the entire age spectrum. We work to engage families and students as advocates for themselves and for their community. So in addition to providing services to young people and providing services to parents, we also do quite a bit of leadership development and facilitation of families from across our network of schools coming together to learn more about what's happening in the community and ways that they can be involved. And then lastly, we work to change policies and practices of the schools and some of the agencies that we interact with so that young people can really be the focus and there could be a shared agenda for helping all young people be successful in school. This is a quick profile of the 2 schools that we have partnered around the bullying project that Joan will describe shortly. They are largely African American, large population of students who qualify for free and reduced lunch. And just to give you a sense, we tend to break out the number of students in middle grades versus the entire school population. So Elevate, when we first launched, we identified a few things, and they just sort of speak to the way we approach the work and why the partnership with Johns Hopkins and several other organizations in the community are important to us. We wanted to make sure that we engaged residents, students, and partners in the planning process for Elevate. And we knew that we couldn't be successful without making sure that the folks that were involved in the planning process were also involved in the implementation and some of the long-term programs and activities that we developed in the schools. We are neighborhood-based, so we work, in addition to the 2 schools that you saw the profile for, we work with 2 additional schools, and we function as a network. We link partners to multiple school sites. We try, whenever possible, to ensure that schools and the staff that work for Elevate are trying to leverage relationships across the network so that all the schools in the neighborhood that we work in benefit. So when it comes to health, we follow the Center for Disease Control Coordinated School Health Model. We believe that the increasing access and utilization requires better coordination and collaboration amongst public and private partners. We are not a healthcare provider. We don't consider ourselves experts in health education. So the relationship that we have with School of Nursing, we have a similar relationship with the Department of Pediatrics at Johns Hopkins Bayview, with Baltimore Medical System, which is a federally qualified health center here in the community. And we also do quite a bit of work, in addition to the project that Joan is going to describe, with the School of Nursing around health education and health promotion in the schools for all grades.
Switch with you. I'm happy to be here. And I am from the School of Nursing, and just to give you a little bit of an overview, the mission of Johns Hopkins School of Nursing is to improve the health of individuals in diverse communities locally and globally through leadership, excellence in nursing education, research, practice, and service. This particular partnership that we're talking about today, it really touches in terms of practice, in terms of faculty practice, but it also obviously it touches in the realm of research as well, and service, I would add, as well. Johns Hopkins School of Nursing has had a long history and commitment to initiatives in East Baltimore. It goes back, we have the Wald Clinic, we have worked with the House of Ruth, we have the Isaiah Wellness Center, and in addition, we've been involved with multiple projects, different faculty along the way, since really the time that we really started, which was about 1985 in terms of the university aspect, the 4-year program. So this particular project that we're describing today it was called No Room for Bullying, and we do want to acknowledge the Urban Health Institute in terms of, it was a fall faculty community small grant awards. And bullying, actually this is the month, October, in terms of bullying. And so it's certainly on a lot of people's radar, and we hear about it almost constantly. So we know that it's defined as physical, psychological, or verbal behavior that is repeated, and it involves an intention to harm, and it's characterized by a power differential between the bully and the target. that definition is actually very important in terms of really working with the children to be able to identify that versus just teasing, because sometimes people think teasing is just bullying, but we really do work in terms of defining it. And we know that bullying is related very much to health issues, psychosocial issues, depression, depressive symptoms, psychosomatic symptoms as well. But it goes beyond health per se. We also know that it's related to a decrease in school engagement and achievement. So hence it becomes really important and should be of huge interest to schools because of that particular piece. And then finally, the other aspect that I want to stress is that social emotional learning is increasingly recognized as a critical component to school success.
So at this point, we thought we would just give you all a sense of what some of the key ingredients to this partnership were, and kind of how we approached the engagement. So first was just making sure that relationships were established between the faculty and staff from the School of Nursing and the schools that they would be working with. So we tried our best to almost immerse them into the school community and culture. Joan herself has attended a clinical team meeting at schools, 7:30 in the morning, to get a really good handle on what the experiences had been of social workers, of guidance counselors, of other behavioral and mental health therapists at the schools. She had lots of conversations with the principal and the school faculty. She could sort of see the behaviors of students by being in the building every day. And this all took place before a project was rolled out. And the Elevate staff, we have a team of 3 full-time staff that work in the schools, a site manager. We're part of the Community Schools Initiative, so Family League. Hello, everyone in the room with Family League. So we have a community school coordinator or a site manager that works in the schools. We have a family advocate that works in the schools. And together, they really function as a connector and a liaison. So when there are times and moments when Joan may experience or had experienced or may have had challenges really building connections with faculty and staff, our staff were there when she wasn't there to try to build up interest and also make sure that folks were aware of what her role would be and what the opportunities were with the School of Nursing. Through meetings and conversations, we tried to create sort of a win-win. There were things that Joan was particularly interested in, or the School of Nursing was particularly interested in. There were resources, whether it was faculty resources or student resources. And so we wanted to create a situation where a need was being met that the principal and the staff had expressed, and in this case it was health education and behavior management. That's sort of really high on every school's agenda. Second to achievement and classroom instruction is how to help students with their social and emotional behavior. So that was sort of an opportunity for us to kind of bring the resources together to create a win-win both for the school staff and also for the School of Nursing. Out of that came some quick wins, and I'm just going to hand it back to Joan to kind of talk about how that came to be.
So those initial years that Nicole just described were really years in terms of building the relationships. Relationships are really critical to any kind of success with any of these projects. So one of those years, and this was actually at Tinch, the principal was really interested in help and assistance in terms of teaching the 8th graders health, because there was no one else there to do that. So that really was a way of really developing the relationships, and I think in terms of gaining the support in terms of what would be happening in the future, and the future then was to pilot this anti-bullying program at the 2 schools that we just talked about. And so it's really important one of the other key ingredients that we have found is that you really have to be ready to adjust your program. Flexibility, I mean, this is just key to public health nursing in general. I'll just say that is my background. If you're not flexible, there's just no way that you can be successful. So that was an important piece here in terms of this particular program, and in terms of leadership, climate, and priorities as well. Some of the advantages of the partnership would be, I would say that it really is and was a means of promoting the implementation of evidence-based programs or pilot testing proposed interventions. I didn't describe the programs so much because I know that the focus really here is on really in terms of process. But I'll just share a little bit in terms of it was an evidence-based program, and we actually implemented it in the school, but it needed to be modified too because of the fact of the challenges, which we'll get into in just a little bit. But it's based on the program Steps to Respect with some modifications. The advantages of this partnership were, I would say, that the leaders really recognized the long-term benefits of a community academic partnership. And when I say by leaders, that really means Elevate, being with the School of Nursing, with the schools as a part of this partnership. And then flexibility and shared responsibility for certain activities is really what happened. That is what made this successful in terms of being able to reach out to the schools and to actually get it implemented. It was really working with Elevate and the schools in that process. So some of the challenges, there are definitely challenges, and I'm sure that you've been hearing about those challenges, and I know you have been today in general. In the school system, balancing the academic demands within the school is really a challenge. This was an additional program that was being brought in and implemented, and the issue is, well, where do you do that? Do you do that in another classroom? Taking over, another class? Do you do it during the resource time? Do you do it in some other venue? So that really becomes an important discussion and an important area of need in terms of identifying that. I can say that within these two particular schools, in one school it was really done during a resource class, and actually in both schools it was a resource class, but in one school, one of the teachers was actually involved with us in implementing this. She was right there in the classroom, very much engaged. And in the other particular school, although the teachers in one class would be there, that person was not involved with the teaching aspect. So the models really change, and you have to really go with whatever is right for that particular school. That's what we found. Another challenge is the whole idea of limited resources and time. This is limited resources and time for everybody, on everybody's part. And then I would say the other challenge is, and I'm sure this has been stressed, is the need to commit to a long-term relationship, even beyond the life of a single project. It's a repeated message that becomes really important. And that's very much related to limited resources and time. So it's tied together. So, anything to add?
Nope, that's it.
Okay.
Questions?
So I'd like to invite any questions that people might have for members of the panel.
I've lived in Bella Edison for probably about 18 or 19 years. I've been a big community advocate around violence and juvenile injustice and juvenile incarceration. And I've heard a lot here today. Like my mind is just spinning. I have so many questions. I really don't know where to start. But I want to know that we go to a lot of meetings and we talk and we talk. We've been talking a long time. We probably one of the most researched cultures in the universe. We got all kinds of data and statistics. So I'll make a comment and then I'm going to ask the overall question. My comment is that we have been talking so much, and when I look at all the stuff that I hear about what's going on and what hasn't been done, is that I really can't see the evidence when I walk outside this building. When I walk outside of this building, when you drive in certain pockets of Baltimore, it almost looks like we're in a third world country in a war zone. But I've heard everything from racism to economic development and all these great things that people are doing, but somehow it's just not tangible. I can't feel it, can't see it, I can't touch it. And you have several people in this room that I know that are very dedicated and have been dedicated to Baltimore, whether we get paid or not. Mr. Smith here, a couple other people that I've seen who continue to do work. And my overall question is that I see all of this stuff, this is real pretty. This is so nice. I got a whole lot of information here. What am I supposed to do with it when I leave here, number one? Number two, how is it that we really get the big elephant out of the room and really talk about racism, classism, and economic development? Because when I hear Mrs. Thompson talk about the community and building wealth, the developers come in and they get wealth. But the people that really live in the community and the people that are really doing the work don't see the wealth. So how is it that we get to a point where we also stop talking about, not talking about it, but I hear a lot about grants. How do we really become a sustainable community by building businesses, whereas though we support the businesses that support us? Because that's the only way that I see that we really make an impact on people, community, and having true sustainability, and also addressing racism, social injustice, as well as economic development. So I have a consulting business, and I really find it shameful sometimes is that people from New Orleans are calling me, people from Atlanta, Georgia are calling me. I have to fly out of my neighborhood to give, to go and give the same kind of service, but yet here it's like, when you say anything about money to people who know your value, who know that you do work. Me and Dr. We've been on each other for a very, very long time. He's even been to some of my events. But at the same time, I gotta fly to New Orleans to get paid, or to Atlanta, Georgia to get paid for the same thing that I'm willing to do here and have them do anyway. But somehow it's just that money, it's just the money ain't the same. The money, it gets real tricky and funny when you start talking. So I really need to know how is it that I can connect with some of the things that I offer in the services with all this information that I'm going to walk out of this room with all the connections and the people that are sitting here.
I know your question was, what do you do with what you have gotten from this this talk here? It starts with all of us actually getting out into the community, not just coming to this event. I've been a child advocate and a community parent liaison since my daughter was in elementary school. When I walked into the school and saw that there were no men in the school, my goal then was to have a way of at least putting one man, myself, into the school so that the young men and young ladies can see a positive role model to start with. Of course, my daughters are now off to college, and I'm still at it. 26 years later, I'm still working with the schools, working with the community, but that's what we have to do on an individual basis with the members of this panel and the members who have visited us like yourself. We need to individually go out into the community, and I love the idea of going into the school. That's where it starts, with those little ones. Just taking a moment, helping them with homework, little small things that begin to build. And that's what it was for me. I helped the child with homework, helped the child learn how to play chess, took them to a football game, then I took a group, then I took a school, then I had several schools, then the department said, oh, that's wonderful what you're doing, do it for us. And that's where I am. So that's what we have to do, individually get into the community. And it starts with you, and it starts with me, and it starts with everybody in here to get into the community and practice what we preach. And that's all I can say.
Well, and I do, is this working? The reason we started the CityLab was in response to people who had exactly the same question, that I can't do a lot as a business professor, but what I can do is change the goal and the practice and even the research of what we do in a business school. And most of business schools are oriented towards preparing people for the corporate ladder and corporate jobs. And in a city like this, what we need to do is prepare people for creating and building businesses in our city neighborhoods in partnership with people in those neighborhoods, and they need to, by the time they graduate from business school, they need to have a portfolio of experiences and projects and businesses that they've actually worked on with people in those neighborhoods. So that's what we're trying to provide. And we're doing small things like the homeowners association, instead of hiring a company from the county to come in and take care of our lawns, which are about this big, we decided to train and hire the kids in our neighborhood so that they have after school and summer jobs. And we're working with the school to help them learn how to run that as their own business. It's a small thing, but over time, I think that's going to make a difference, that we're using business skills and business people locating in the same neighborhoods as people who want to know how to create wealth and want to learn to do that for themselves. And I think that's where, at least that's where I think we're starting. It makes a difference over time.
First of all, I feel you, because I get the same treatment. I've been flown to New Orleans and Atlanta on a regular basis. I have frequent flyer miles from them to do presentations, but none in Baltimore. But in terms of what you said about why you don't see anything in the community, a lot of times it's because we put sorry politicians in there that are owned and paid for by people, and the big businesses continue to get things we don't. You look at what's happening now in this city, it's a shame. You know, if you don't have it, you won't get it, because the politicians don't support it. Why aren't some of the politicians here today? See, that should be the question, first of all. Why aren't they here? They should be interested in this, because after some of these things are started, they should be able to get some money behind it and make it an initiative for the city or the state. But they're not here because they don't care. Their concerns are somewhere else. So, you know, we always want more, but we still put the same people in office. That's why I said those kids need to be a part of this process, so they can continually see over the years how nothing's changing. Children will change. I'm seriously, you know, I've talked to quite a few of them. If they could vote today, they would change a lot of things. Talk to some of them about what's going on in politics now. You know, with the furloughs. Some of the kids said they would get all of them out of office. And that's the kind of thinking you need, because if they're not doing any good for you, they need to go. Now, we have programs that are ran by different entities here. They can't do everything. When that program is over, there needs to be a plan for continuation, similar to what they have. You know, this is just one step in the ladder. So we gotta look down the road and see what the ultimate goal is. If it's to get all the way to the top, then we need to start looking at how we can get to the next step. And if, you know, when these programs come and they start talking about they want to do research and so forth, what happens afterwards? That should be the question. It really should be the question, and it should be a concerted effort by both parties to see how you can go to the next effort. A lot of the resources that you all have with grant writing, when you come into a community and they're struggling and you know they're struggling, strengthen them, help write some grants. I went to a conference in Seattle, Washington, and the group in Ohio wrote 4 or 5 grants for the partner neighborhood organizations they had. Made sure that they weren't going out of business, that when they needed people to come in and set in those sessions and so forth, they were paid just like the staff was. They never had participation problems because of that reason. So we need to get a little more proactive and get more people involved. If your program only calls for a certain amount of money to go into this initiative, then look for other money. Help the community organizations do their part and get some. It's foundations that would support those efforts if they were true collaborations. So we need to start demanding more, and we'll get more, and we can give you all more.
Ms. Thompson, I was listening, I was actually quite taken aback by the program that you all are doing, just because there is an interesting part of that I did not hear as you were describing it, because you talked about micro enterprises, you talked about Jonestown. I'm happy that you're down there. That's an area that I grew up in. I know quite a bit about that. But there's something there that I did not hear, especially when we're talking about it. And again, this brings us back to what's been going on and talked about here in terms of partnerships, in terms of investing. We're talking about an institution that can raise hundreds of millions of dollars a year. And the one thing I did not hear about was whether or not there was what is known as a micro investors fund. And what that is that is a fund that is set up by institutions. It is governed by institutions. The funds are passed out just as though they and the individuals or the projects come in, kind of as though they are coming into venture capitalists. They're working with business students, so they can then teach them how to do business plans and come in and see if they can get it funded. But that's one of those things I did not hear about, and I think that would be something good to look at, because it would also be something that can actually be generated and could be tracked fast and be moved to some of these other communities. Because right now we're working in the Monument Street area where EBDI is. They're talking about redevelopment, just as they did in Jonestown. We have Monument Street that's falling apart. There's an area that surrounds there with many people who are interested and know how to and understand business or have businesses, which is part of what is known as a shadow economy. But they need to have people connected. So if you all have begun thinking about that, I'd love to hear more about it.
Yeah, I can respond to that. We have two things going on. One is at the business school, we have a couple of they're not microfinance, but they're social innovation and tech innovation funds. We're building funds specifically for that purpose. But there are a number of funding platforms in Maryland and in Baltimore. So what we're doing in Jonestown is two things. We're developing business projects and business proposals that we can enter in competition in those funds. And we haven't been doing it for very long, so they're not at the point where they can actually compete, but probably next year they will be. And then the second thing that we're doing is we're creating what we're calling the Benefactory, which is a Jonestown residence-based kind of a co-op development model, so that you can, if you're a resident of Jonestown, you can actually purchase through sweat or time equity, not just money. You can buy into the corporation just by doing other things besides money. You can volunteer, you can teach kids, you can work in the garden. There are things that you can do so that you have a stake and you can get paid back on that investment. So you don't have to invest dollars, but in the end, the return is in dollars. So now I've got students working on the business model for that, but I think that's kind of similar to what you're talking about, that it's a way for people without capital to take advantage of the benefits that are coming to the community and get capital out of it without having to invest capital. Does that make sense to you? Okay.
I wanted to bring a new report to your attention. It's called Measuring the Impact of Anchor Institutions in Building More Sustainable Communities. And it was just published by the Democracy Collaborative. And the concept is that anchor institutions like hospitals and universities and communities, that there should be indicators to see how they are impacting the neighborhoods in which they're based. And I think that's a very important project to think about, because it develops indicators and metrics by which you can measure impact of a variety of investments. The other thing I'd mention is the concept of community benefits agreements. And we developed a community benefits agreement with Columbia University for about $150 million. in which we've developed a number of projects around legal aid for evictions because they help gentrify the community. The business school has developed programs to provide leadership and management training for nonprofits in West Harlem. They have committed monies to maintain the new West Harlem Piers waterfront project. And so there are numbers of projects that have been developed over the last 5 years through this community benefits agreement. So some of the issue is really being organized. And you have access to the university, and communities really need to figure out the 3, 4, or 5 key priorities and develop some plans and programs and begin to organize and use the media and public relations to begin to put pressure, for the kind of investment you want. And it sounds like there are a lot of university folks here who are willing to invest and be involved, and perhaps there just needs to be a little more guidance and a little more organized pressure.
Come to the last event on the agenda today. I'd like to invite Claudia Now, Rebecca Adnafu, and Lorraine Finney up. We're going to have a conversation about the effective translation and communication of research to improve community health. We are a little over time, so this will probably be a bit shorter than we'd originally anticipated, and then we'll close with some networking, and we have some refreshments for everyone to enjoy. So I think Claudia Now is going to set the stage, and Rebecca Nafu will help run the conversation.
This is about how we want to communicate research findings in a way that participants in the research studies and also community members really can benefit from them. And this comes out of a lot of conversations that I had, and where I heard that people were concerned that there was very sparse information flow from researchers to the participants or to the community. So this is the beginning of a longer conversation on the responsibilities, or what we see as responsibilities of the researchers towards participants and the community, and towards the opportunities and the challenges of sharing research findings. So for today, we have 3 goals, and I wrote them down so I hold us accountable to them, okay? So we want to hear what you think about this. And the first is that we want to find out what we consider the responsibilities of researchers towards research participants and the larger community in terms of the kind of information that is shared. The second one is, what information do you think is most important to be shared, and how can we practically do it? And the third one is that how can we make this a two-way street? That is, how can we hear from participants and communities, getting feedback and hearing what they have to say. So I did a little bit of research to prepare for this session tonight, and I found, for instance, that Johns Hopkins has a website called Your Health, or a newsletter actually. Does anybody know about that one? 1, 2, okay, not widely known, I see. And I also had the chance to talk to Crystal Evans from ICTR, who told me that there are some studies that actually have community events, that they have activities with participants, and they hand out flyers where they actually keep participants and community members in the loop. However, I have the impression it is not the rule yet. So I would invite you that, knowing that some things are being done, so that we start thinking about what else we can do and also how we can do it. And I'm really glad that we're joined today by Mr. Finney from the Finney Group, who, among other things, is a specialist in marketing and event organizing. So you'll bring the practical knowledge to this conversation, and Rebecca, who's the Associate Director for Community Engagement, who's going to moderate the discussion. So please, I invite you to tell us what you think, and I hopefully have a late but lively discussion. Thank you very much.
We want to have a free-flowing discussion, okay? I heard you. People have been talking at you, lots of talk. Exactly, I acknowledge that. So this is opportunity for you to do the talking, okay? Because this is about communication, effective communication, okay? So if I say, salam ጤና ይስጥልኝ እንደምን አላችሁ? ሁላችሁም ትሰሙኛላችሁ? Oh, pardon, il faut que je parle français. Tu comprends maintenant? Oh, okay. Then I need to speak English. Hi, how are you? So we're going to do effective communication. So what's the difference, okay? I'm communicating to you, but I see blank faces because the first language I use or the second language I use, you do not understand, okay? So sometimes, some of you do not understand. So sometimes what happens is that when we do research in partnership with community organizations, there is translation problem. Okay, translation to community. That is what we're trying to break, that barrier in terms of effective communication. Because sometimes it seems like we're talking different languages. Okay? So researchers are talking their language, community-based organizations, their language, and we're supposed to be partners, but we're not understanding it. Okay? So if we do not understand, we cannot be effective. Whatever research work that we have done, we cannot apply it effectively. Okay? So how can we break the barriers that exist to make effective communication between us? What are our responsibilities as researchers? And I don't want to just say, what are our responsibilities as researchers? Because I also operate at community-based organizations. What are the responsibilities of community-based organizations that are sitting here? So if we're partnering with researchers, we have to take that information, right, and apply it with lessons learned. And sometimes we do not, because we remain comfortable sitting where we are. Change is sometimes difficult. And change is also difficult for researchers. This whole effort around translational work, and also the federal government, a lot of time not requiring within the proposals that request proposal, you have to have a community partner. Okay? So I'm going to listen, and you're going to talk. What are the responsibilities of researchers? What do you want to tell them? Listen to me, active listening. What is it that you want? And then what are the challenges, and what are the opportunities? And we're going to listen, because that's where it starts. And a lot have been communicated to you. And you can also refer to what has been discussed and share what are promising practices around effective partnership. We're gonna take notes a little bit, and we're gonna do dinner. But tell us what works. What is it that you want to hear? I'm going to ask community-based organizations first, or our community partners. But I also want to listen from researchers later on. Yes, I see a hand up there.
I think the first thing is to define what a partnership actually is with community-based organizations. When you look at a partnership, both parties should benefit. If the program is to put a project into the community, is that benefiting that community-based organization? It's benefiting the community, but it's not necessarily improving the capacity of the community-based organization that's involved in the process.
Improving the capacity of community-based organizations is really essential if we're talking about partnership. And that's what you would like to see. Absolutely. Okay. Who else?
Hello, everyone. My name is Gina Baez. I work for the health department, and for 11 years I coordinated an after-school program called Mi Espacio for Hispanic middle school and high school students. And a couple of times we collaborated with researchers, and just from my point of view, what happened, it made it difficult sometimes because, first of all of my parents spoke Spanish, and we had to get consent, and then when we had to get the consent, we had to sometimes read it over the phone, the whole thing, so that the child could participate in a focus group or something like that, which was just not practical. And sometimes that was stopped me from collaborating more with researchers. I think in general, I have a good feeling that, it's for a good purpose, but the practicality of it is just the logistics of it, sometimes it's just not practical, and was very difficult to just, move on and do more.
Lengthy, complicated consent forms that take a long time, right?
Yes, and sometimes, we couldn't do it, just get the consent to the child, give the consent to the child to take to the parent and bring it back with a signature. We had to read it. Either the parent had to come in person to sign it, or I had to read it over the phone, and it was like a 3 or 4 page thing that I had to read over the phone. It was just not happening. So if there was another way to do it, I think make it less cumbersome for the organizations, it would be so much easier.
You can also share opportunities at this point. Okay.
Good afternoon. My name is Tamar Millar with the Family League of Baltimore. And I think one of the things that my mentor had taught me was that if you have good data, you'll have good research. If you have good research, then you'll have good policy in place. And I think it comes down to a standpoint that you're making sure that, one, the respondents have actually a great level of faith in terms of those who are trying to bring about the research. Because so many times communities have been so exploited in which the information that they provide is distorted. And so in that case, how can you feel a great level of confidence in terms of being able to respond to any respective surveys? I think to the point that Mr. Burnett just made, I think you just sent me an email a couple of minutes ago. In terms of the point that he made, in terms of when you're looking at impoverished communities, in terms of how many folks actually have telephones. So how are you going to be able to reach out to those individuals if they don't even have mechanisms in which calls that go out in terms of robocalls to be able to get that information? And so again, I think you're looking at it from the standpoint in terms of how do you get out to the individuals to get the good data.
Now, I just want to add in terms of policy. Policy, unless it's applied or enforced, is just sitting on the shelf and not applied also. So thank you for perspective. You have a question.
Can I ask you a question, a little bit rephrase it, is do you feel adequately informed of what is going on in the house on the hill? Do you wish you knew more? And what is it that you would like to know?
So you
and this is in terms of, I'm saying this is in terms of research. So this is in terms of research findings of Hopkins.
And think about research findings. Think about recent information that you have received. How have you received them? So if you think about phenomenal research information that has been shared with you in recent years, what was phenomenal about it and how was it shared?
I'll say this, with the young black male blood pressure study, there was a demand that you have dissemination, because I told him, if I'm going to be a part of this, then you got to let the community know what the benefits were, what you found out, if they're going to die tomorrow or we can fall off the earth, so it's no need of doing it if you're not going to give them the findings as a result of it. So that piece, I don't have a problem, because that's always something that's high on my list. Just like with HIV, we had testing at the center. They wanted to do testing, but they didn't want to provide services afterwards. I said, hell, they want to know if you're not going to help them after they find out they positive. So it just seems that one goes with the other. And if people don't have that in mind, that they're doing a disservice to the people that they represent. So for me, it's just an automatic thing, because I think about myself. I would like to know what you found out about the information. You asked a question earlier about the CBOs being able to make a difference. One of the things I've been saying since I've been talking is sustainability. When you working with people that have a number of problems, a whole plethora of things, we often bog down with what we're doing, and we try to get people involved, but we don't have the time or the manpower to go out and one-on-one tell them like we should. And I guess that would be considered a problem of the communities. But when you're trying to sustain a program that's beneficial to a lot of people, it's not easy. And to be that rebel is something that we would like to do, but we can't make sure that the message is getting out there because we got to try to keep our doors open so that we can help the people that we help. So, you know, I know that there's a dual responsibility.
Yes.
But, you know, at some point we got to be realistic. We can't do everything. And, you know, if my door's closed and I'm out in the community telling people, we've lost a great deal because from my standpoint, I can leverage what I have to do more. But if my door's closed, we've lost that leverage. So then the community is really at a disadvantage. So yeah, we do have a responsibility, but at some point we got to be realistic about our ability to go out. With the community health initiative, I made calls, I made announcements at community associations about it, but I can't make sure that the people come for that simple reason.
I wanted to just comment on some of the thinking around the issues that have been raised, and I think that all of them have some level of truth to them. I think it's complex given the times in which we live and the economics that we are all dealing with within the university and outside of the university. Funding and money is hard for everybody these days. And I think that what I heard from many of the conversations today is to be transparent in what you're able to do and in what you're not able to do. I think when we try to partner with organizations that are very fragile and we don't have the resources to help them sustain themselves, then we have to ask the question, is it ethical to enter into that partnership? I think that as researchers, we have to also understand what are the obligations that we can make to those communities and those organizations, and we have to follow through on those. I think that this notion of sustainability is much bigger than just the mere name of it, because we don't want to sustain things that have not worked. That we've done that, and that's a disservice to everyone. I also think that sustainability is not only the role of the researcher, but it's the role of those who you are in partnership with. Because the real name of the game is how do you build that capacity for that organization to continue to thrive and do the things that it wants to do and not to rely on researchers or on research. I think the issue of research burden is very real. It's very real in this community. It's very real in most communities where there are institutions. It's not a Hopkins issue. It's not a UNC issue. It's not a UNCG issue. It's not a Morgan issue. It's not a University of Maryland issue. It is one that we all have to deal with and acknowledge. I think also when we enter into agreements with our community partners that, you know, that relationship needs to be specified in terms of what you can bring to the table and what they can bring to the table, and how do you work on the plan of mutual benefit. I think it's not a one kind of answer. There's no one solution. I think that every partnership is unique, just as every relationship that you have with your partner, your husband, your wife, whoever it happens to be, it's unique. And you have to work out what are those unique characteristics that make that work or doesn't make it work. I think we also have to know that there are times when partnerships just don't work. And how do we get out of those in a way that doesn't burn bridges. So I think that there are a number of issues that are relevant in this conversation that we've had today, and I don't think that there's this one be all. I don't think that the fault is of anybody, any one agency or individual. I think we're all who are here are striving to make these partnerships work, and we're striving to make Baltimore a better community.
I know there's one, Ernest, you have a comment or question, what? And then we'll move on.
So my response is more or less around the point of dissemination of information. And one of the things that has concerned me, especially as someone who's actually participated in some research studies, and I'm probably one of the most identifiable people in the room. If you don't know me, my name is Ernest Smith. That way you'll know who I am, and we aren't strangers anymore. So that, you know, it's easy for people to, because they have information, they should be able to get back in touch with you at least and let me know what the result is, because that's one of the conditions that I have in my participation. Some of them I've heard from, some of them I still haven't heard from, and I have been unable to catch up with the individuals whom I had met to do the study. So that's one of the issues that I also have. It's about the information dissemination for some of these studies, and that may actually be practical to communities if we could get that information.
How best would you do that? Would you have a suggestion?
Oh.
How best would you do something? Do you have a suggestion how best?
Well, see, I'm not sure how to handle it on the other side. The best I could do is reach out and try to contact those that I knew I was in the study with, or at least my contact person. Now, on the other side, I don't know what happens. I do and I don't know what happens because it varies from project to project. So I don't always know what happens once it gets inside. How do I get it back out?